I didn't get that on video, but okay.
We're good.
You're rolling.
Cardiac arrest version 2. Matt squared. Okay, we are arriving we get dispatched for collapsed 72-year-old male. We arrive on scene. Family members here see a 72-year-old male patient who's collapsed on the collection floor. It doesn't seem responsive. As I approach, I see the scene safe. There's one patient, me and my partner. We're a BLS car, and if he's unresponsive, I think I'll call for ALS. So I'll just call probably, okay, can we get ALS? If he's not responding at this point as I'm walking in the room, I'll just go, hey, can we get ALS on scene? Come in and ask favorably, hi, what's going on today?
George just was short of breath and then he collapsed.
George, can you hear me? No response. Check for pulse. No pulse. Matt, can you start chest compressions? Just continuous chest compressions. I'm going to get the pads on. Okay, pads are on. Just continue CPR until it tells you analyzing.
Low battery, analyzing heart rhythm. Do not touch the patient.
Feeling for pulse again.
Shock advised. Stay
Unclear, you're
of
clear.
patient.
VFib on the
Delivery
monitor,
shock
shocking now.
Press the
Clear.
orange button. Shock
Right back on the
delivered.
chest, please. I'm going to go get look at patient's airway and grab OPA and bag valve mask, okay?
Begin
So
CPR.
2 minutes continuous chest compressions until I get bag valve mask ready for you, okay? Good. So I'm just going to look in his airway. Do I see anything in his airway? Sure?
Yes. Yep.
Of course.
Clear.
Just found a random tap note filter, Matt. Cool. I'm missing a reservoir bag. I guess we're going without it. And I'm turning that on to 15 liters. Okay. I'm gonna. So, do you know what happened today? Before he went into cardiac arrest?
He was just short of breath and he gave me a call and I got here and he was on the ground.
Okay. Has anything ever happened like this before?
No, nothing like this, no. He's had a heart attack before, but he's never collapsed from it.
Did my IV bag disappear? I swear there was one there just for the last call. We just ran a cardiac arrest. Did you not stock the bag after? Matthew? How many times have I talked to you about this? So he's never had anything like this before?
Not with a collapse, no.
Okay. Does he, do I feel pulses with compressions?
Yes.
Say yes. See jugular veins? Okay. Any history of any recent surgeries or anything like that?
No surgeries.
No? Okay.
He has heart problems though.
He has heart problems.
Yeah.
What kind of heart problems does he have?
Analyzing heart rhythm.
Okay.
Do not touch the patient. Shock advised. Stay clear
So
of
I'm going to switch and do
patient.
severe
Delivery
if you want to
shock
start an
now.
IV in between. I got the bag out. Unclear, and why don't you press that? Unclear, you're clear.
Clear, shocking.
You say the unclear, you're clear, everybody clear, shocking
Unclear,
now.
you're clear by shocking.
Shock delivered.
Okay, going right back.
Pause. If needed,
Just grab
begin
the stuff around
CPR.
you. Does he have any lung problems?
He has emphysema. Heart problems and
6, 8,
emphysema.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 30. 26, 27. I'm going to listen to lung sounds this time. Okay, I have air entry bilaterally around the last. Okay. Open it wide open. Let's say it's running like that. 30. Last cycle. How's he been feeling in the last few days, the last day or so?
He hasn't really complained about anything.
Just had chest pain today?
Didn't mention chest pain, but he did tell me he couldn't catch his breath.
Okay. Is he on home oxygen?
Nope. Lots of meds though.
And just do compressions right up to the machine tells you, okay? If you have extra time, I was a little bit ahead. So we're going to switch. Finally, I'm
No
going to
shock advised.
talk again.
Pause. If needed, begin CPR.
Still no pulse during the analyze, so we'll start into CPR. So now I'll have my brain back again and I can talk, as you'll notice. So he's got chronic lung disease. He seemed really short of breath before. We have air entry now. Probably you might hear wheezes if his condition, depends on his medical condition before 30. Can you give me a little bit more loud heads up so I don't, just tell me when you're at 25. Any history of being sick in the last few days? Hasn't had any big infections or anything like that?
I know of.
Is he a diabetic?
No.
Okay. Does he have a history of any kidney problems?
Not that I know of.
Hasn't had any recent GI upset, vomiting, diarrhea, anything
No.
like that? For hyper or hypoglycemia? He's obviously not hypothermic. Tension pneumothorax. We had air entry bilaterally. We also don't have distended neck veins. As far as cardiac tamponade, do I have pulses with compressions?
Mm-hmm.
Okay, so not likely cardiac tamponade. Also don't see 25. Any chance that he may have accidentally or intentionally overdosed on anything?
I don't think so, but there's a lot of medications available to him.
Okay, but does he have any psychiatric history, any
No,
suicide
no history.
attempts previous? So this could be a coronary event. This could be his hypoxia before. We're giving him high flow oxygen. We've got an OPA in place. During the next rotation, when I take over CPR, I'm going to get you to put a King LT in.
Uh-oh.
Analyzing heart rhythm.
Okay.
Do
You go
not
ahead and put
touch
King
the
LT in
patient.
while we're doing this.
Advise.
Analyzing, I
Stay
feel no
clear
pulse.
of patient. Deliver shots now.
So you go ahead, because again, I'm not going to lean over him and shock. I'm clear.
Yeah.
You're clear.
Okay.
Everybody clear.
Shots delivered. Pause. If needed, begin CPR.
No. Get the syringe and stuff inflated. Does he have any allergies to any medications?
No allergies, no.
What medications is he on?
He's on metoprolol, Lipitor, Nitro, ASA. He's got 3 different peppers, and
25.
he's on HCTZ.
Okay. Do you know his medical history?
He just has heart problems. He had a heart attack last year.
30. Sorry, buddy. I feel like we're gonna get him back this time. I have that feeling.
That's good. Come on, Georgie.
You're going to the syringe for the PLP.
28, 29, 30.
Analyzing heart
Remarkably on
rhythm.
time. Analyzing,
Do not
feel pulse.
touch the patient. No shock advised.
I feel a pulse.
Pause.
Can you get a blood pressure
If
for me?
needed,
The NIB and the
begin
SpO2 would be lovely. Okay, I'm just gonna come up to his head, make sure. Is our King LT in place? Let's say it didn't get there, you couldn't find the syringe?
No.
Okay, we'll have to give you a big syringe, but let's say it's not in place, that happens sometimes. So I'm gonna open up the airway, see if there's anything in it, jaw thrust. Nothing in it?
No, we're clear.
No. We're very kind.
I know.
Okay, put the OPA in. Can you put this, listen while I bag him and see if we have good air entry while we're ventilating him, just to make sure. And I'm gonna set my metronome to breathe, tell me to breathe every 6 seconds or 10 breaths. It's okay to hyperventilate, listen to bases too. Hyperventilate while during auscultation, that's fine. Just don't continue to do it. Good air entry, Bruce? Okay, I'll just set my metronome so I don't have to think. It's an iPhone 4, it's coming.
Blood pressure.
Blood pressure? What's our blood pressure? 68 on 40. It's low, don't you think, partner?
Yeah, very
Look and
low.
see how much fluid we have into the patient right now. I generally glance at jugular veins all the time when I'm thinking about fluid, so I just say, how do the jugular veins look? Let's say I'm visible but not grossly engorged. Air entry was clear, so I'm not worried about pulmonary edema right now. So let's continue with the other 500 mils of that, okay? So let's open that wide open. And I'm gonna get you to take over bagging here if you don't mind. I just want you to, now that my phone's finally on. Every time you hear a noise, give them a breath, okay? Nice slow breath, just until you see chest rise and fall. So, now I'm just gonna step back and say, what pieces am I missing? I can turn this over into monitor mode. I'm just gonna, because we have a pulse, it'll alarm if it goes into a shockable rhythm. It makes sense that we partner, do you mind checking a pulse every couple of minutes and make sure that we still have a pulse. Also put the SpO2 on, that's another good indication. If we have a good SpO2 pleth wave, then another great indication that we have a pulse at present. He's got a heart rate of 120. Okay, so we'll have to pay attention to why that is. I've done his allergies, and now I'm gonna do just a rapid physical assessment, okay? So I'd go to his head, look in his pupils, shine a light in his eyes, come down his neck, trachea, jugular veins, and all the way down, okay? Just like an incoherent medical patient. If I haven't got a complete history, as far as ample at a minimum, and what OPQRST is available, then I would ask that, and I'd probably take time to dig in a little bit further, and then we'd start making decisions about transporting this patient. Okay? Make sense? We can stop there. How long was that? 12-ish minutes?